Abu Alpha to the podium to do his presentation. Thank you.
Thank you. Good morning, everybody. And this will be a presentation that we're giving on behalf of all co-authors of the ClarIDHy, which is a global phase 3 randomized double-blind study of ivosidenib versus placebo in patients with advanced cholangiocarcinoma with isocitrate dehydrogenase IDH1 mutation. These are our disclosures. ClarIDHy was available for patients who have histologically confirmed advanced cholangiocarcinoma with centrally confirmed mutated IDH1 by next-generation sequencing, good performance tests up to ECOG-1, 1 to 2 prior lines of therapy that one of them should be included either 5-fluorouracil or gemcitabine, and measurable disease as measured by RECIST 1.1. There was a pre-screening of IDH1 mutations, and then accordingly, patients were randomized 2-to-1 in a randomized fashion for ivosidenib 500 milligram daily, nonstop, versus placebo. An important point is that the patients on the placebo arm, if they were to show any radiologic progression of disease, they were allowed to cross over to unblinded ivosidenib treatment. The primary endpoint was progression-free survival, which was done by blinded independent cancer radiology review, and secondary endpoints including safety and tolerability, the PFS by local review, overall survival, response rate, and quality of life, pharmacokinetics, and pharmacodynamics. The progression-free survival curve is noted over here, which shows the Kaplan-Meier, which kind of split about the time of the first CAT scan, as you can see, which is about 1.5 months or 6 weeks, with clear separation from that point on in favor of the ivosidenib, which is noted in blue, versus the placebo, which is noted in red. The hazard ratio was 0.37, with a p-value less than 0.001. The median is 2.7 for the ivosidenib and 1.4 months for the placebo. The 6-month rate for the ivosidenib was 32%, and it was not estimable for the placebo because there were no patients there at that point in time. And same thing for the 12-month PFS rate, 22% for the ivosidenib and not estimable for the placebo because there were no patients left on that arm. The disease control rate was 53% for the ivosidenib, 2% partial response, and understandably, in view of the cytostatic nature of the drug, 51% stable disease. The overall survival, as you can see here, is again showing a difference between the ivosidenib and placebo in favor of the ivosidenib, 10.8 months versus placebo, 9.7. Understandably, in view of the crossover that was allowed and permitted on the study, we added a PRSFT evaluation for the placebo arm that will make us calculate the overall survival as if the patients never crossed over to the ivosidenib treatment. With this RPSFT, the improvement or the worsening rather in the overall survival of the placebo arm dropped to 6 months, and now we're comparing 10.8 months for the ivosidenib versus 6 months for the placebo, with a hazard ratio of 0.46 and with a p-value of less than 0.001. And again, to confirm, the blue is the ivosidenib and the red is the placebo before the RPSFT, and would focus on the blue versus the green, which is the RPSFT calculation for the placebo. And as such, ClarIDHy is the first phase 3 study of targeted oral therapy of non-cytotoxic mechanism of action in advanced metastatic cholangiocarcinoma. The significant improvement in progression-free survival by central review and the favorable OS overall survival trend, tolerable safety profile, all support the clinical benefit of ivosidenib in patients with IDH1 mutated cholangiocarcinoma. This pivotal trial represents a practice-changing result where genomic testing would become the standard of care And of course, other than the drug itself, it will open the opportunity for more target-specific trials in this rare indication where limited progress has been made over the past decade. Thank you very much.
Thank you. Thank you so much, Dr. Abu Alfa. Now we'll have Dr. Angela Lamarca to briefly comment about this work.
Thank you very much, Ignacio. So from my point of view, these results are practice-changing, mainly because this is the first randomized clinical trial exploring precision medicine in cholangiocarcinoma. As you have seen, those patients who had an IDH1 mutation were benefiting from ivosidenib, mainly in the form of progression-free survival, which means that the cancer was for a longer period of time under control. I do appreciate that looking at the medians, the benefit may not seem clinically meaningful, but from my point of view, this trial is practice-changing and showing a benefit in progression-free survival, especially if we focus our attention in that percentage of patients who are free of progression after 6 and 12 months since the treatment was started. So we are having 20% of patients free of progression at 12 months and 30% of them at 6 months, with 0 patients in the placebo arm. And finally, regarding the overall survival results, I think if we focus again our attention in the overall survival, when adjusted for crossover, a benefit from 6 months to 10 months is definitely clinically meaningful for patients who with cholangiocarcinoma who unfortunately have a very poor prognosis. I think moving a step forward is very important that we try and make sure that all our patients have access to molecular profiling, which at the moment is a challenge in some of the countries. So that's one of the homeworks that we get from this ESMO 2019.
Thank you very much, Dr.